After college, after college, there was a period of my life where I was addicted to a lot of YouTube content that drove me in a very negative direction. And that direction was generally about business and kind of quitting my path towards a professional school. And I got into a lot of the self improvement content where we can make like $10,000 a month, quick ways, like drop shipping style stuff. But as I was starting to learn about that, there was no fulfillment in doing so. That path was meaningless. For me, that path was almost characterless. And I just knew that I wasn't fulfilling my purpose until 1 year went by. I didn't get any acceptances from any PA schools that I might have reached my rock bottom in terms of my whole career. And that point made me realize that if I have a career in medicine, I have to put in so much effort into the application cycle. And I did just that. It's easier said than done, but when you are hitting rock bottom, you turn on a self that is so competitive. And that's what happened. I put a lot of effort into my interviewing skills, and eventually I ended up getting in to a PA program. Fast forward a year, I'm already done with 1 year being in medicine as a PA student. Welcome back to the channel. My name is Harsh Patel, and I am a physician assistant student. And in this video, I will be sharing some of my lessons that I have learned over the last year studying medicine. These lessons are also kind of my reminders to my future self, wherever I am in a year or two. I could just refer back to these lessons that I've learned. And so the first one is it should never be about money. I always often ask myself, what does my life look like in 10 years from now? Am I having fantasies that is filled with a large house, lots of money, maybe a nice car? Or is it filled with fantasies of how many knowledge I have gathered about my patients? Number one, it should never be about money. I always ask myself deep questions sometimes when I'm sitting alone. For example, one of the questions is, what does my life look like 10 years from now? And if my fantasy is about having a large house, lots of money, a nice car, I think I've failed myself a little bit. Compared to if my life is filled with fantasies of how much knowledge I have gained about my patients, certain disease processes, do I understand the treatment, and I can treat a patient successfully without any complications, or even a great business idea, or even being successful in YouTube, I will have won myself. Because over time, I have really become spiritual. And what I've realized that things, physical things and money, they all solve problems, but they do not change your mental state. And so I don't want to ever associate my career about money and take steps that give me more money as a PA one day. Because if my career is driven by money, I will be doing business with my patients at the end of the day. And healthcare, managing health, promoting health, promoting preventive medicine is not about money. It's about always the other person. It's not about yourself. And this kind of ties into Bhagavad Gita, which is a Hindu scripture where I time to time return to for some life advice, some spiritual knowledge. And I always remind myself that I have to be detached from the desires of my results. I don't have to be lured by fruits of the actions. This is a very tough concept for 20 somethings like myself. I'm only 24, so sometimes it is really hard to wrap myself around it because money is a shiny object and I love money, but I do remind myself that I shouldn't ever take any career decisions based on money. Number 2, physician assistants are not assistants. They're not even lesser or more than doctors or NPs either. Growing up, I was always pushed and always kind of forced to not even consider, be a doctor. I was essentially forced in my mind to become a doctor one day. And though my family had the best interest in me, I knew that for me as a parent, forcing and putting a concept of a career in a kid's brain constantly can do more harm than good when they are in their 20s trying to figure out their own career. And one of the struggles that I had growing up is, as even other brown families, other Indian families, other immigrant families who kind of push their kids to become doctors, they fail to understand the role of a provider in the healthcare system. Like, they don't understand it. And I feel that through my content, I could spread the knowledge. Through my content that I make on other platforms too, for other social media, I can spread that word around. That this is a team sport. Like, I cannot emphasize enough that without PAs, doctors are nothing. Without nurse, doctors and PAs are nothing. Without doctors, PAs aren't anything. And without patients, doctors and PAs and NPs won't even have a job, which is very hypothetical. They're always going to be patients. But the point is that the essential point is, like, many cultures do not understand the role of physician assistants. Physician assistants are not assistants. And this has to be this knowledge has to be spread into so many cultures, because PAs have to be respected just like other healthcare professionals. Lots of people around me growing up did not understand, and to this day do not understand what PAs are, which makes them harder to respect me. You may be in the similar position where you are a PA student or you are a PA and your family does not understand who a PA is. And everyone deserves respect, but healthcare workers deserve kind of a special respect in that they have to go through so much training in order to treat, diagnose conditions. And I think personal story of how Indians perceive what a role of PA is, like that has to be brought upon, like the awareness. There are also like some biases my culture gets into, that PAs is better for girls and being a doctor is better for guys, because less training is better for girls because they have to be uh, able to bear a child soon. It's just easier for them. This brings in another point. Like, don't force your kids into something they don't want to be. Bringing us back to the main topic, PAs are also not just PAs. And in my experience, when I try to make content for my personal pages, when I try to make content for my school Instagram, and now I'm also starting to make content for a company called Healthy Savannah, which is dedicated to just all things health in Savannah. I understand that regardless of your position in your career, you can make an impact on so many levels through social media. Like, if you use social media in a good thing, like, it is so much more for you. So making content for my school, personal pages, and Healthy Savannah, I am understanding the impact I could have on someone just by being solely a PA student. So never back down from the vision you have envisioned for yourself, because you're not just a PA student, you're not just a PA, you are so much more. And that goes with, even though you are a doctor, like if you are like an internal medicine doctor and people say you are just a doctor, people say you're just an NP, you're not just an NP if you want to try to change someone's life. Like, it doesn't matter. It's how you use social media and what kind of change you bring about in people's lives is what truly matters. And you're not just a healthcare professional. You're so much more, and be proud of that. Number 3, focus is the most important skill, tool, hack. Number 3, focus is the most important tool for studying in life. I am constantly reminding myself to focus more, because focusing more equals more time. If I don't focus, I don't have time. That is simple. For example, imagine a gambler. A gambler is hyper focused on one thing, but that one thing is just one part of his life, and that one part of his life is affecting his other parts of life so much that he's losing time because he's just not focused in his main parts of life. So the more he hyper focuses on gambling, the less time he has, because majority of the time is going on stuff that doesn't even matter, and all his other parts of life are crumbling down just because he doesn't have time. And this is a huge part too here. So growing up again with Indian culture, like, we also don't prioritize mental health. We don't only understand what mental health is, we brush off mental health. We don't even seek treatment if we have mental health issues. And we don't even create habits that improve our mental health. And that's honestly the most, that's like the most people around me, it's just the truth. Like I have to be so real. I want to have this podcast to be, I want this podcast to be real as hell. And so these experiences are real. And so growing up, no one around me was focused on improving their mental health. And I do think that I might have some symptoms of ADHD. And I'm realizing that the more stress I have, the more things that I stress on, and the more I don't know how to cope with my stress, the worse my focus is. The more I'm able to get distracted. And the most I have felt that I've been distracted was just recently. My last 4 months, I've been very distracted. And part of the reason was PA school stress. The amount of information that we have to go through is insane. And the amount of credits we have taken in the last 4 months has been just crazy amount of credits. And so that, along with the stress of not doing well in certain exams, had really impacted my focus in a negative way. I would check my phone every 10 minutes, wanting to get stimulated about from like a new message or a YouTube video that my favorite creator posted, getting distracted with like just Instagram, TikTok content, because whenever I am in PA school, like whenever I'm in my semester, I don't really focus on content that much because it's kind of like becomes like a hobby than a main thing. And so I have struggled with focus, and now I have I've started to improve my focus with this a month break we have had from school. And for the past 2 weeks, I have created a great morning routine for myself that has given me a little bit of kind of personal education of how my focus works and what I need to do every day to have that focus throughout the day. And so some of the things that I would like to share quickly that I've been doing for my focus is I've been waking up early, I've been grooming myself, I've been praying, and then I've been meditating. So couple things on those, couple notes. For me, I feel like if I groom myself early in the morning, I feel better and I feel good about myself. And then prayer and meditation, I always wanted to include consistently, so I have been consistent for the past 2 weeks, and that is going really well. And then some other things I have started to do is I have this app, and this app is wonderful. It's called OneSec. And whenever I open Instagram, TikTok, or YouTube, what this app does is something really cool. So when I open these distractive apps, what happens is it loads the OneSec app, and then it asks me questions about, do I truly really want to open this app? Because more often than not, whenever we are opening these distractive apps, we are doing it in a way that's so unconscious. It's almost habitual. And OneSec is an app that kind of intervenes that habitual process and makes it into a conscious one. And that is what I like about that app. And that app has saved me, honestly, an hour and a half a day. from mindless scrolling and some mindless phone addiction. Some other things I've been doing is incorporating study sessions, even though I have a break. I have been kind of getting into that flow state and studying like these topics that I'm really weak on. Like some of the weakest topics I'm weak on is just women's health. And so I've been brushing up on those topics, but I am trying to focus for a long period of time. I'm trying to not use my phone, first of all, in that study session. I'm putting my phone away. I'm using white noise. And I am having some coffee or caffeine sometimes. I'm having tea right now, but I'm having caffeine. And then I'm taking this supplement called L-theanine. And so L-theanine is a supplement that promotes focus, that promotes mood relaxation. And this has really helped me out in terms of getting into that flow state. And I've felt it. So I'll be making some more content on L-theanine soon because I think it needs a separate video. But those are all the things that I have been working on during my 1 month break, just after I analyzed my whole year and I said, I can really focus better. Like sometimes when you sit down and ask yourself these questions and like kind of analyze your year or analyze your month, I'm pretty sure we all have that one thing that we can improve on. And I think my thing is just to focus better, because at the end of the day, focus equals time. And time, you all know, is money. I really like this quote from Cal Newport's book, Deep Work. 2 core abilities for thriving in the new economy. 1, the ability to quickly master hard things. 2, the ability to produce an elite level in terms of both quality and speed. So for me, it is really important to master hard materials. Like we learn hard materials every single day. We go through ton and ton of information, and we have to understand that information, make our own notes. Sometimes I have to make my own tables. I have to make my own study guides and study questions and sometimes flashcards from the material I have learned. And that is a way to process that information and learn it better. And that can only happen if I can focus well enough in class and out of class and during group study sessions. Number 4, rely on systems than motivation. Some of the things I do is eating the set amount of meals every week. So I meal prep every weekend and I calculate every single thing like calories, protein, fats, and carbs and put it in my calorie calculator app. And the app I'm using is Carbon Diet Coach. And that app helps me track everything. And I already put it in the app for the week's meals. So I'll have like 4 set meals every single week, and I will have all of those tracked before the week starts. That makes my life so much easier. So I do all the prepping, meal planning, meal prepping, everything in the weekend, along with calorie tracking, macro tracking. I do everything in the weekend. So I don't have to think about it during the week. I just have to add those foods in my calorie calculator. Some other things that I do which are non-negotiables are gym 4 times a week. Because if I lose that habit, I know I will be miserable. And I had seen that in the last 2 months because I suffered an MCL injury. And I was out of the gym for a couple weeks and my grades suffered. because they never suffered. It could even be that the material was harder, but it could also be that maybe going to the gym helps me focus better. And I'm willing to bet on that fact more than the material getting worse. Some other things are just creating set times to study. So having a study session from 6 a.m. to 7 a.m. is a set study session for me. And so I follow that rule every single day, no matter what. Studying from 7 p.m. to 9 p.m. is another study session, and I follow that rule no matter what. Avoiding using phone on my desk is another one of my things that I do. And I kind of do that. It kind of happens 90% of the time anyways. So I'm happy with that. And then lastly, I have made a rule of not multitasking, like studying while watching a show or a game. I think that's the worst thing for my focus. So I never study and do something on the side or watch a game because it's not efficient. I'm not enjoying the game, nor I'm focused on studying. Number 5, fear is a hallucination. No one cares about you more than yourself. Any potential embarrassments are always in your head. So when all the sportsmen talk about how excelling at something is mostly mindset, they are right. It's the quality of the mind that really impacts your performance along with the skills and knowledge. So whenever you start on a new journey, whenever, let's say, you start on a new weight loss, like you have 50 pounds to lose, you're like 50 pounds overweight, and let's say it's December 31st, and you just know it, that you just have it in you to lose those 50 pounds, but you're kind of scared. You fear to fail because you know that by the end of day 5, you're going to eat that double cheeseburger from McDonald's and a large fry. You just know that in your heart. But here's where mindset comes in, and here's where fear comes in. Let's say that person does end up eating a large amount of calories on that day 5. They go to McDonald's and then they have this large 1,500 calorie meal with a large soda, a large fry, and a double cheeseburger. The poor mindset goes like, fuck it. I ate this now. I ruined my fat loss. I'm worthless. And I don't deserve to lose weight because I'm a bad person. I just broke my diet. However, the person who doesn't fear anything, the person who has a strong mindset will say, yeah, I had this large meal, but you know what? It's just one meal. I enjoy myself today, but for the next week, I'm going to get back on the diet. And yes, let's say they just got back on their diet again. The poor person will not even consider going back on the diet again. Will not try to get back on that diet again and progress towards that healthy lifestyle. But that strong mindset person, the person who doesn't fear anyone or anything, who doesn't fear their own behavior, they keep going, and eventually by the end of that year they end up losing 50 pounds. And that is where I think the mindset plays. And that goes on with career too, with skills that you want to learn. You start med school next July, or you just started PA school this year in January. You fear everything. At one point, you will be like, I want to quit. I can't do this anymore. But you take a break one day. You set you reset your mind. That's why it's important to manage stress. That's why it's important to do self-care habits like meditation, prayer, uh, working out, running, whatever you're into. That is why it is important to do all those things. Poor mental quality, aka constant fear and stress, plus skills equals poor performance. I'll say that again. Poor mental quality or fear, constant stress, plus skills equal poor performance. It's like you are multiplying 100% by zero. Because having a poor quality mind with high quality skills will always bring you poor outcome. Compared to a high quality mind and a person who is willing to learn skills and who's willing to understand whatever they can in their power will always bring about the best performance. Currently, I'm listening to a book called The Mountain Is You by Brianna Weist. Did I say that right? Brianna Weist. Recently, I've been reading a book by Brianna Weist, and I really like this quote. Your mountain is the block between you and the life you want to live. Facing it, also, facing it is also the only path to your freedom and becoming. You are here because a trigger showed you to your wound, and your wound will show you to your path, and your path will show you to your identity. I think it's just a beautiful, beautiful quote. Number 6, complaining is a temporary drug to feel good about your current problems. Every single morning when I pray and when I meditate, I have to remind myself of certain things, like to focus more. But I also have to remind myself that complaining is not going to change whatever I am feeling or struggling with right now. Because complaining puts you in a mental state so far away from focused state. I think focus is a destination, and whenever you're doing a task or whenever you are a study session, you are trying to achieve that focus state. But that moment of complaining, every time that you think of how hard this is or how better it could be, it is hindering from you to being focused. It is hindering from you it is hindering you from being focused. So you focus less and the time is lost. Like we said, more we focus, more time we have. It also kind of it also removes you from a state of learning and empathy, which leads to, again, time lost and poor mindset. Because if you're not empathetic about your own situation, about other people's situation, by default you have a poor mindset. It also increases burnout because of the amount of stress, mental stress that a person accumulates when you complain. You are where you're always meant to be is probably the greatest quote. It is probably one of the greatest quotes of all time. And when I was scrolling to TikTok one day, I came across this PA student's TikTok saying how she hated PA school. And she had more followers. She had a lot more followers than me on TikTok. But it's so wrong to make content about how you complain about your own profession, because other medical professionals, other students, other college students who look up to you are watching your content, and they are taking in this negativity from your own experience. Even though if it's your own experience and opinion, you are allowed to share that, but keeping in, like, it's just not being aware of what kind of impact that video can have on a college student who wants to become a PA or a medical professional. Sometimes TikTok does more harm than good because everyone makes content, and every piece of content that is viral doesn't mean it's good. Doesn't mean, objectively speaking, in terms of TikTok's criteria, it is good. But when we kind of think of, okay, objectively, is this a good material to post? I don't think so. And so if you are in a situation where you feel like you complain all the time and you always think of, I wish this was better, and I wish that was better, you are in it for the wrong reasons. And when I mean by you, it's also reminding myself, because for me, PA school has given me a different experience. I think 2024 was one of the best years of my life because I was able to put my career forward. And putting my career forward meant to learn about different diseases, learning about how I can influence a patient to become healthy, people to become healthy, not only through practice, through clinical skills, but also social media. Because I truly believe that my career depended on medical knowledge and improving personal health and influencing people to improve their health as well. And so I hope you like this podcast. I hope you learned something from it. And I hope you take things forward. If you can, share your comments down below, any lessons you have learned as a medical professional, whether you are a PA student, med student, doctor, NP, any profession, nurse, in any profession, so that people can learn from these lessons that I have, or your lessons, make sure you put them down below. And I hope to catch you in another podcast. See you and take care.